How is it that the wealthiest country in the world has such a screwed up healthcare system? After 35 years in the healthcare industry, I decided to retire and share my secrets with you. I'm Chuck Melendi, and this is Disruptive Dialogue. Hello, Disruptors. Chuck Melendi with Disruptive Dialogue. Today, my third episode on dealing with private health insurance is solutions and strategies to navigate private insurance in the United States. And I am so excited. I will tell you right now, this is probably one of the most important and exciting episodes that I will have done since I started doing this. We must become better consumers. And look, we have to do our research. When it comes to the second half of the year, we need to start to get ready for enrollment in insurance plans. And I'm going to give you some timelines, but don't wait till November, December to do this. Remember, health insurance is going to cost you thousands of dollars every year. Treat it like you're buying a car. Treat it like you're buying a house. Do your homework. Do comparisons. And I'm going to give you some tools today to let you do that. Work with your healthcare practitioners to navigate the medical landscape. Hey, if something's happening to you, I guarantee you they've already seen it. If you're denied or delayed care, don't get frustrated. Don't give up. You have rights when it comes to insurance denials, and you can go back and you can fight those. Every insurance company, they have processes in place to help you do that. States have laws to help you do that, and physicians' offices will help you. And lastly, if insurance policies are hurting you or those you love or people you know, let your legislators know, because if we don't do that, nothing's going to change. So first off, what we're going to touch on today, we're going to touch on what your health insurance covers. You need to know, what the hell does my health insurance cover? Secondly, you need to take advantage of all the health benefits that are fully covered by your premiums. I was shocked by some of the stuff that, bottom line, by law, because of the Affordable Care Act, there's a ton of stuff that when you pay your premiums, you get things for free. Now, most of those are going to be preventive, but that's okay. You know, there's a ton of stuff I didn't know that were covered, and it pisses me off that I didn't know it already. You need to know when you can enroll, and you need to plan accordingly. And I'm going to give you some dates for those. And lastly, leverage all the resources available to you. Look, man, when I wanted to buy a piece of property, I go to realtor.com. I use a real estate agent. I go on the web. This should be no different. This is a huge purchase for you. So once again, all this is going to be in my show notes. I have slides for this. I'm old school. I can't help it. But insurance enrollment periods. We touched on this in the first episode, talking about private insurance 2-3 weeks back. Open enrollment, when you can sign up for your insurance, starts November 1st, okay? That's usually for private plans, such as like an employer or the ACA marketplace. But just know, November 1st, that's when you can start to enroll. But please do not wait till November 1st to do your research. And I'm going to give you some great tools that will make it easier. So bottom line, most health insurance companies typically will publish their benefit designs. And by that, I mean, what are their plan details? What are the rates? What are their formularies? For the upcoming year, they'll usually publish them between August and October. And sometimes that depends on the market or the regulatory requirements. But bottom line, the ACA marketplace for individuals and families, you usually can find their benefit designs between late September to early October. Now, they'll still be there in November, December, but try and look at those in September or October so that you're not waiting to the last minute. Now, employer-sponsored group plans, both large and small groups, usually carriers are going to have their benefit designs to the brokers and the employers between August and October. So once again, you have plenty of time before November 1st. Now, we don't talk a lot about Medicare Advantage yet. We're going to in future episodes. But once again, those benefit designs are usually available for people to look at in late September and early October. And that is what we need to do. So I'm so jacked up about this part. Look, I'm 60 years old. You guys know it. I do my best with the internet, the web, all that kind of stuff, technology. Chat GPT, I got to tell you. Well, first off, I'll tell you something funny. I was calling it Chat GPT. G as in gorilla, B as in boy, T as in Tom. And I think I actually said it on the podcast a couple of times. My wife said, it's Chat GPT. I'm like, okay. So I'm getting more and more used to it, but there I'm making fun of myself. But look, I was blown away. I'm a huge fan. And look, I know AI and I know Chat GPT isn't always 100% correct, but let me tell you, it is an incredible tool. And please do me a favor. And when you're done with this podcast, I want you to try this, okay? So I said, you know what? I'm going to see, after I went through that first episode of like how premiums can differ by age, by income, my health, where I live, my zip code, all these things, I'm like, let me put in a scenario. So I'm going to share with you a real case example. And I put into ChatGPT, what's the best coverage if I was a 28-year-old female? I had very few health conditions except for anxiety. I live in Detroit, Michigan, and I make about $60,000 a year. Holy shit. I'm talking in less than a minute. ChatGPT said, here's how to figure out the best health insurance coverage for a 28-year-old woman in Detroit, Michigan, earning about $60,000 a year with minimal health needs, but mostly anxiety treatment. I'm like, oh my God. So it basically tells me, the first thing it said is, let me see if you're going to qualify for subsidies with the ACA marketplace, which they have. And it walked through federal poverty guidelines, if I'm close, if I'm not. So basically what it told me is I'm just above the subsidy cutoff. So apparently in Michigan, 400% of the federal poverty line for one person is around $58,000. Well, I said I was making 60. So it said, oh, you just missed the cutoff to get a subsidy to help you lower your price. So it actually said, we'll address how to maybe get your income a little bit lower so you can qualify. I didn't even ask it to do that. So then it said, what type of plan fits best for you? And it gave me three options. One was the ACA Marketplace Bronze or Silver plan. Another option was a high deductible health plan plus an HSA. And another one was a short-term health plan. And it's crazy. Like for the first option, which was the ACA Bronze or Silver plan, it says who this fits. If you only see a doctor occasionally but want mental health coverage, which all ACA plans must cover, the typical cost in Detroit for a bronze plan is $275 to $350 a month. That's going to have a high deductible of around $6,000. If you go with a silver plan, that's around $350 to $450 a month, so a little bit higher premium, but the deductible is lower. It's going to be $2,500 to $5,000. And it says, why does this work for you? Because it covers prescriptions for anxiety meds and therapy sessions, even if the deductible is high. I'm like, holy shit. That is awesome. I'm not sure I'm going to use what it says, but let me tell you, if someone didn't have a clue about health insurance, just typed in a little bit of stuff, you could get this type of information. But I love it. But wait, there's more. So now it says, well, let's look at this. Okay. If you're a 28-year-old female in Detroit, you're making $60,000 a year, you're not going to get a subsidy, and you're healthy, but you need mental health coverage. The best balance is usually going to be a silver level ACA plan or a high deductible health plan with an HSA. It says, how might you choose? Well, if I want predictable therapy costs, then I would go with the silver plan, and that would have copays for my therapy. If I wanted a lower monthly premium, but I can handle out-of-pocket cost risks, then I would go with the bronze plan for a high deductible health plan plus an HSA. So it gives me options. And then it says, you know what? Where do you shop for this? Well, go to healthcare.gov for ACA plans, or for some local Detroit options, some of the common carriers are Blue Cross Blue Shield of Michigan, Priority Health, and McLaren. I'm just cracking up at how much it's giving me. So then that's the answer it gives me. And then proactively, it asks me, hey, would you like me to find the actual 2025 premium estimates and the best Detroit plans that have mental health coverage? And number two, Would you like me to give you a step-by-step way to lower your taxable income so you qualify for an ACA subsidy and save around $200 a month? Yeah. And then 3, would you like me to compare the ACA plans versus employer-based plans versus a catastrophic short-term option side by side? Hell yeah. So which one do you want? I said all 3. It said, okay. So that's what it did. It gave me the actual 2025 premium estimates and best Detroit plans that had mental health coverage. It gave me for Blue Cross Blue Shield of Michigan, their bronze plans, their silver plans. It gives me the resources where they pulled this from. They also looked at broker aggregated data for bronze and silver plans, but the bronze plan not through Blue Cross, but via Oscar, or the silver through Aetna. So it's giving me other options. And then it basically said, look, Michigan's rate filings confirmed that Blue Cross's HMO Silver Saver plan in Metro Detroit costs $380 to $410 a month. I'm like, geez Louise, this is insane. So basically it gave me my projected premiums based on my profiles, if I went with bronze or if I went with silver. So the last piece it said is, look, mental health coverage and ACA protections in Michigan. All the ACA marketplace plans, bronze, silver, and gold, must cover mental health and substance abuse services, including therapy and anxiety medications, no denials or lifetime caps allowed. And it gives you resources. In addition to that, it lets me know that Michigan law ensures that ACA protections at the state level, including guaranteed mental health coverage and no discrimination based on pre-existing conditions. Let me tell you what, if you are saying to yourself, you know what, I've never done a whole lot. I don't know technology. I don't know insurance. Look, if you got a freaking computer and you have the internet, you go to www.chatgpt.com and you type in, don't put in your social security and your name and all your personal information. Just put in your description. I'm a black male who's 32, pre-diabetic, great shape otherwise, make $100,000 a year. They don't know who you are. Put that in there, say where you live, say your zip code, boom. You're going to get all this stuff. I will tell you, I am floored that this is available. So then it tells me my different options, from the ACA bronze plan to the silver plan to the high deductible plan to the short-term or catastrophic plan. It gives me my premium, my deductible. It's ideal, like it says, ideal if you use minimal care beyond your prescriptions. What's your pros? Low cost monthly, HSA compatible. What's the cons? Therapy and meds out of pocket costs until the deductible is met. It gives you all these things. It's shocking to me. And then it says, okay, you asked me to give you a step-by-step way to lower your taxable income so you will qualify for ACA subsidies and save about $200 a month. It walks me through that. How to lower taxable income and possibly qualify for subsidies. So, bottom line, even though the enhanced ACA subsidies remain in place through 2025, Michigan's local premium cost is low enough that a $60,000 income may not qualify you for substantial tax benefits, since the subsidy cliff is gradual and not abrupt. But it still gives me ways like contributing to a pre-tax 401k or IRA, using HSA contributions, claiming deductions like self-employment expenses. So it still gave me options to look at this. It was mind-blowing. And then, just to make my life easier, I told it, sure, give me a summary comparison table that gives me the different plans that you think I should use. What's my estimated monthly premium? What is my out-of-pocket cost and deductibles going to be? What's my mental health coverage for each one of these plans? And according to what I want, which one is best for me? This is groundbreaking as far as I'm concerned. So then lastly, it gave me recommendations. So it basically said, given that you anticipate moderate mental health use, a silver ACA plan from Blue Cross Blue Shield of Michigan is likely your best fit. And it goes on to say, It's going to give you predictable copays and coinsurance for therapy and anxiety meds. It's going to give you access to mental health benefits immediately. It's got a broad provider network in the Metro Detroit area. Your monthly cost is $360 to $400. And if you prefer lower premiums and are comfortable paying higher out-of-pocket until deductible, maybe you want to go with the bronze high deductible health plan plus an HSA. That's worth considering. And that will also allow you to build some savings. And not only that, but look, it's just going to hold my hand. Where to enroll and next steps. And it tells you the marketplace enrollment window, but you already know this because I told you, runs November 1st to January 15th. And you need to select by December 18th for January coverage. You can shop on healthcare.gov or michigan.gov. Focus on carriers like Blue Cross Blue Shield, Priority Health, and Better Oscar or Care Source. And you just do a little bit of homework. When you look at these different plans, evaluate your therapy copays or coinsurance, evaluate the prescription drug tiers that your meds are going to be on, look at the mental health network access, both for in-person or telehealth, and your out-of-pocket maximums. It is giving you guidance and advice. It is freaking awesome. So Chat GPT is our friend. Now, look, I know there's cons. It's true. Chat GPT isn't always 100% accurate. Information actually is limited as to what's available on the web, and providing personal information can be scary. But look, don't provide your personal information. Just do it anonymously. It at least is a great starting point. It disseminates so much freaking information that's out there, which overwhelms us. It disseminates it quickly. I'm talking all that information it gave me was less than 5 minutes. At the very least, you become a lot more literate as far as healthcare goes. It allows you to tell your needs, and it gives you different comparators to look at. And if you don't want to take any of its advice, then at least you have some options to get you started. So that's my tutorial on Chat GPT. And people who have worked with me in the past are just laughing because I'm not Mr. IT, but boy, was that easy. So I'm going to just change gears real quick to finish up the podcast. Look, at the end of the day, we've covered, the enrollment periods, when you should start to look, that you need to be prepared, that you have tools like Chat GPT. But at the end of the day, you really need to know, and this is in my show notes, what does health insurance cover? And look, we all know it covers many services, procedures, and treatments, like hospital visits and doctor visits. But you also need to be responsible, know that you're responsible. Even though when it says something's covered, it doesn't mean it's free. It means that the insurance company will cover it if you pay your premiums and you pay your deductible. And once your deductible is met, then it will help pay usually the lion's share of whatever costs after that. But you're still going to probably have to pay some copays and some coinsurance. Now, something that you need to really be aware of is when the Affordable Care Act passed back in 2010, it guaranteed that plans offered on the marketplace exchange has to cover at least 10 essential health benefits. Now, once again, coverage means it covers, doesn't mean it's free, but this includes your ambulances, emergency services, hospitalizations, mental health and substance use disorders, pediatric services, pregnancy, prescription drugs, you name it. There's 10. They are essential benefits. And one thing to note, that while that is through the ACA marketplace, the ACA marketplace requirements also apply to fully insured employer plans. So if you're with a small group plan that is fully insured, then you also can refer to the ACA marketplace and get those same benefits that apply. Now, if it's a self-insured, like say you're with a large company and they're self-insured, they probably will include many of these benefits, but they don't have to. So that's a good thing to know. I did not know that the small group or fully insured plans had to cover pretty much what the ACA marketplace plans cover. That is a really good thing to know, especially for small employers. Now, one thing, and I love this, I titled this page, "If it's free, it's for me." Because look, one thing that we don't take advantage of, and I said this the first episode was that we have to pay our premiums every month, whether or not we get insurance, whether or not we get healthcare services or not. Well, guess what? With the ACA and with most premiums, a lot of things are covered, and they're covered full cost. You don't have to pay anything. A lot of those, like I said, colonoscopies, mammograms, your annual checkups, usually like your vaccinations, your flu shots, all that's usually going to be covered. But it's crazy, and I got to read this. So preventive services covered by premiums under the ACA, the Affordable Care Act, private health insurance plans must cover recommended preventive care services without any cost sharing. That means no deductibles, no copay, no coinsurance. And what that means is that preventive care services, as defined by guidelines from organizations like the U.S. Preventive Services Task Force, have to be provided at no cost to the patient. Now, it says, the question comes to you, well, do all health insurance plans have to be ACA compliant? Individual and small group plans are required to cover the ACA's essential health benefits. Large group plans, usually self-employed, do not. So let's go to what is covered when you're talking premiums and preventive care. So certain categories of preventive care are broken down. There's like 3 categories. One is for all adults, one is for women, and one is for children. And so what I have, and I'm not going to go through all this, it is literally shocking how many services are provided. I'll give you some of them. But bottom line is, for all adults, stuff like one-time screening for abdominal aortic aneurysm, blood pressure screening, cholesterol screening, diabetes screening, diet counseling, hepatitis B screening, Hep C screening, HIV screening, lung cancer screening, obesity screening and counseling, tobacco use screening, TB, you name it. All those are covered for adults. Now, in addition to that, for women, what's covered, and when I say covered in the preventive services, these are free: breastfeeding support and counseling from trained providers and access to breastfeeding supplies, birth control, folic acid supplements, gestational diabetes screening, Hep B screening, maternal depression, preeclampsia prevention. Oh God, what else is in here? Urinary tract or other infection screening, bone density screening, breast cancer, mammography, genetic testing. I mean, it is crazy how much is available. And then they even break it down for children. So autism screening, behavioral assessments, blood pressure, blood screening, depression screening, developmental screening, hearing, height, weight, and body mass index measurements, Hep B screening, HIV, lead screening, obesity screening and counseling, oral health risk assessment, vision screening. It is crazy. These are all free through the ACA marketplace. These are all free for your small group, fully insured plans. We really need to know what's available, and we need to use those services. If we did that, go onto my website, look at the show notes, check out. I've got like 9 slides of all of these that are available. Or you can just go to healthcare.gov and say, this is where I'm insured. What preventive services are free to me? And you don't have to take my word for it. So look, I left in the slides, once again, resources. And my resources, I think you should use Chat GPT. Go to the Google, healthcare.gov, Kaiser Family Foundation, CMS.gov. Go to your pharmacists, your physicians. Hell, call your insurance companies. On the back of your insurance card is an 800 number. The people on there are super informative, super helpful. If you call Medicare, they're amazing as well. At the end of the day, we need to take some responsibility. We have to become better consumers. We need to do our research and not wait till the last minute, and no more excuses. ChatGPT can give you everything you need in less than 5 minutes. You need to work with all the healthcare practitioners to navigate this crazy medical landscape. If you are denied or delayed care, Do not give up. Don't get frustrated, get determined. You've got rights and you can appeal, and there are processes in place for that. Lastly, at the end of the day, if anybody, a hospital, insurer, a PBM, hell, a provider, if they are hurting you with different policies, you need to let your legislators know. We need to fix U.S. healthcare, and without you, it's not going to happen. My name is Chuck Melendi. This is Disruptive Dialogue. I hope you'll subscribe. We're starting a new newsletter, and subscribe to it. I send out stuff all the time on LinkedIn. If you're a newsletter subscriber, you'll get stuff in addition to my podcast. Take care and be safe.